Welcome. My name is Ryan Cooper.
And I'm Jeremy Bates, and we are the co-founders of a company called Radiant Anesthesia. We're here today to talk to you a little bit more about who we are and kind of really dive into the space that we have now called home.
That's correct. Yeah, I guess we'll start off by saying that Radiant Anesthesia, we are a new anesthesia group in town, and we are an office-based mobile anesthesia group. So we are doing entirely cases in office settings.
Right, and for us, this has been quite a journey. We both worked in the OR space for about a decade, doing everything from brains to trauma, seeing basically every type of patient presentation to the point where, just about everything became routine.
Sure. So I'll just start. I mean, Jeremy knows, we've had these conversations like this before, but I spent almost 13 years basically doing hospital, surgery center-based anesthesia, and just kind of started experiencing what I would describe as kind of burnout in that setting. It was a lot of call, a lot of weekends, a lot of traumas, a lot of add-ons, emergencies, really sick people, and it just started, I think, kind of weighing on me a little bit, that type of schedule.
I mean, that's a great point, and I think that hits the nail on the head. The ongoing joke in my house was, Dad, are you going to be present for X, Y, or Z? And that's kind of what made me personally look into the mirror and say, you know what, I really enjoy this type of patient care, but I think I can kind of combine patient care with focus on my own personal life. And kind of in doing some exploration, Ryan really kind of hit the nail on the head with his exploration and opened an avenue that I never really knew existed.
Yeah. So just a quick bit about me. I've got 3 kids. My oldest is 15. I have a 13-year-old. Those are boys, and I have a 6-year-old daughter. And similar to Jeremy, I was missing things left and right. Lots of weekends, a lot of games, a lot of tournaments, birthday parties, and decided to make a change. I had plenty of career left in me. I felt like kind of nearing the prime of my career, basically, and wanted an opportunity to bet on myself, and that's kind of how Radiant was formed. And Jeremy and I have known each other for about 10 years or so, and decided to team up and go at this together.
Right. And real similar scenario for me, 3 kids, wife, really focused on family, but just kind of saw that slipping away and always wanted to be, in charge of a business. That actually was my original training. I have an accounting degree and always saw myself kind of more on the customer service side of things and just the customer acquisition, business building side. And so kind of when we got to talking, we just really hit it off on our vision and on what we saw as the next level of anesthesia in a space that arguably was begging for a new entrant.
Correct. So he's referring to office-based anesthesia, which, if you don't know, maybe you want to kind of give an explanation of what that means versus when people think of anesthesia, they usually think of hospitals, surgery centers, those types of settings. So what is office-based?
So office-based anesthesia is pretty synonymous with what it sounds like. We are providing anesthesia in an office space. However, we are providing OR level anesthesia in an office space. And what that really means is that we're going to bring everything into the office to transform whatever setting is present into an OR. And that kind of really establishes a safety component, a convenience component, and allows portability.
Absolutely. Right now, what we're doing, essentially how we're starting, is we are doing a lot of cases in offices for dentists, essentially. And so it's allowing them to keep some cases in their office that otherwise would have to be referred out or may not be done at all, or we have to be done at a hospital or an oral surgeon's office, something like that.
Yeah, and I mean, I think kind of the beauty of this and the untapped potential in this market is that there's just kind of been a standard that either A, this is something we can do in the office, or B, this is something we can't. And the big limiting factor was, will the patient cooperate with whatever procedure it is we're going to do? And every patient comes from a different anxiety or baseline kind of apprehension component. And this now opens the door to keeping those patients in the office, but most importantly, doing it very safely, to the point where these patients now have an option to do something as simple as get a cleaning, or something as complex as, implant surgery in the office. And not only that, the ability to potentially bring 3 or 4 or 5 visits into one by combining those, allowing the patients to just really only take one day off work.
Yeah. So before starting all this, Jeremy and I sat down and we had hours and hours of discussions about what we wanted Radiant Anesthesia to look like, and where we wanted it to go in the future. But basically, like, what is our true foundation? And obviously the biggest part of that is safety. Patient safety comes first, and there is nothing that ever supersedes the importance of that. But afterwards, we wanted flexibility in scheduling. We wanted personal relationships with the offices that we go to and service, because we realized it is a big deal for somebody to open their doors and to allow us to come in, take care of their patients in their office, and feel comfortable about that. And we want that comfort level with these offices. And so the personal relationships, it's big. We really want to get to know these people. We want them to feel extremely confident that we are going to take the best care of their patients that they have.
Right, and unlike kind of some of the corporate entities entering this market, Ryan and I have been extremely focused on that, both patient-doctor relationship and also the doctor-doctor relationship. We want to meet everybody in this space, and we are constantly learning as we make these relationships more about the space, more about the people, more about the teams, and just how rewarding kind of the whole concept is. And so rather than try to build something super fast and pump a bunch of people into a company, we're really focused on organically growing a product that is truly unique to the market.
Correct. In addition, ease of use. That's what we are striving for as well. If an office that we've developed a relationship, or maybe beginning to develop a relationship with, find somebody that they feel would benefit from being asleep for their procedure, the process basically is as simple as give us a call, tell us what time, what day, and how long you want it, and we will take it from there. We will call the patient. We will make sure that they are a suitable candidate to be put to sleep in an office. We will answer any questions they have regarding the process, explain to them, the safety level that they'll be experiencing during their procedure, and basically go from there. We bring everything in order to do the case, with the exception of oxygen and suction, to an office, and it's a one-stop shop. Afterwards, we'll call them. We'll make sure that they're doing okay. They'll have our numbers. They can reach out to us if they need something in the future, if they're having any questions or any concerns about what they're experiencing after the procedure. That is our goal. So it's basically a phone call from an office, and we will take it from there.
Yeah, Ryan, I think you've hit all that on the head. And kind of on a lighter note, just this whole process, it's just been fun, hasn't it? It really has.
Yeah.
Like the transition from essentially kind of being in that OR structure where there is, the docs that have been in the group forever, and then the new guys, and kind of working within that structure, really not having a say in the overall leadership, kind of contrasted to what we're doing now, which is like, we're getting out there and we're just focusing on doing something that people like and want. And we're pivoting as we continue to
absolutely
gain knowledge. So, I just can't say enough about, how lucky I am to be working with Ryan in this space, and all the folks that we met along the way. It has been just transformational for me personally. Just really kind of changed my life.
I'll echo that as well. Same. I think that we're fortunate to kind of have found ourselves in a similar place at the same time because we have different strengths and weaknesses, and I think that we complement each other well. We've identified that there is a need in this market for high quality available anesthesia in office-based settings, and we aim to fill that need, and I think that we'll do a good job.
Yep. And thanks for learning who we are today and what we are hoping to grow to and offer as a company. And we hope that at some point you entrust us with your patient care.
Yeah. And this will be an ongoing series where we'll have topics where we'll try to help educate people about certain aspects of anesthesia or mobile anesthesia or in-office sedation. We want people to be entertained and to be informed, basically. I do have a question for you, Jeremy.
Yeah.
What's the thing you're going to miss the least about hospital-based anesthesia?
I think it's probably the unpredictability of life. Not only do you know that you're going to have upcoming call shifts and weekends and so on, I mean, that kind of comes with the territory, but the unpredictability of a day is something that I'm not going to miss. Just, hey, day's going to end at 2, no, it's going to end at 7. And, that can happen in any space, but this space really, allows you to kind of have some more control of your own life.
Yeah. Work-life balance. It's super important, and I lacked that in my previous job, for sure.
Likewise.
The thing I will miss the least is OB anesthesia. I'm happy to never do that again if I don't have to. So that was a little bit of the bane of my existence. I didn't mind the procedures and stuff, but just the hours of that was absolutely ridiculous. And I'm sure all the anesthesiologists out there who watch this will understand.
Yeah.
Yeah.
Thank you all.
Thank you.